Cannabis is the most single versatile herbal remedy and the most useful plant on earth. No other single plant contains as wide of a range of medically active herbal constituents, says famous neurologist Dr. Ethan Russo. Now, marijuana definitely has a negative connotation for no absolute reason. The benefits of this plant definitely outshine the downfalls, so don't allow negative feedback to get in the way of one's happiness. I know I can't be the only person who's had such a bad doctor visit because their doctor seemed so tense and stressed. Now, imagine if that doctor had a way to relieve their stress by marijuana, but obviously not at work, during their own time. I was against marijuana for the longest time until I actually began smoking it. Then I noticed that it improved my mental health by giving me mental clarity and mental strength. Today I'm going to persuade to you why healthcare workers should be able to smoke weed by explaining 3 things: how it enhances your creativity, how it is shown to improve your mental strength, and how it relieves stress, which are 3 things that are all necessary for anyone who works in the healthcare field. First, let's discuss creativity. Medical professionals continuously have to find a way to accommodate to their patients, whether they speak a different language or, for example, a patient comes in the ER with 2 broken legs and 2 broken arms, and now the staff has to find a way to accommodate to that patient because they can't handle them the way they would if they didn't have those broken legs and arms. Robert Donna and Jonathan Plucker, both substance abuse counselors, stated that marijuana appears to have neural impact on cognitive performance. Long-term heavy use is associated with intellectual development and working memory, meaning that marijuana is noticeably enhancing the user's memories and causes them to think more creative and logically rather than those who don't. Marijuana has a positive effect on the cognitive part of the brain, which is the cognitive part is responsible for information processing, conceptual process, perception, language, and a lot of other things that come along when developing the human brain. During an entire shift, which is approximately 8 to 12 hours, can definitely be mentally draining, and marijuana has been proven to help for those long, irritable days. Mental strength is absolutely necessary for anyone working in the healthcare field, especially during times like this where the public really has hope on these frontline workers. Joe Bello, the director of the National Class Action for Therapeutic Cannabis, stated that the action of marijuana causes the body to breathe slower and more expansive breathing, which is a relaxation sensation of the parasympathetic nervous system, which is responsible for the fight or flight mode in our bodies. So COVID has definitely caused a lot of stress during times like these. Stress, anxiety, and depression. And healthcare workers are on the front line defeating this virus hand on hand. Now imagine being in this situation where you're working in these very tight N95 masks and you're working right next to the virus, hoping that you don't get it. What would you do in that situation? You would obviously be stressed and tired. Now, marijuana has been proven to relieve stress. And it is an unknown fact that one of the most stressful places to work in is healthcare facilities, hospitals, doctors' offices, etc., etc. Studies indicate that the healthcare workers have a higher rate of substance abuse and suicide than any other profession, with elevated rates of anxiety linked to job-related stress, which the CDC stated, meaning that medical professionals constantly have to be under stressful situations to be selfless, to care for others. And marijuana is not an abusive substance, which is why it's mainly used for pleasure. marijuana abuse does not cause drug intoxication death, nor has any drug-related deaths since people have been known to smoke weed. Marijuana is not dangerous, definitely abuse safety. Regardless of what you're consuming, whether it be water, pineapple, other stuff, too much of anything can definitely be deadly. So, of course, people have to take it in moderation. So, after all that being said, do you think healthcare workers should be able to smoke weed? Do you think that it'll be safe for them to smoke weed? So, after discussing why healthcare workers should smoke weed, the importance and benefits of weed, how it enhances your creativity, how it has been found to improve your mental strength, and how to relieve stress, do you think that people like this should smoke weed? Now, philosophers stated that marijuana enhances our mind in a way that enables us to have a different perspective from a higher up, to see and evaluate our own lives and the lives of others in a privileged way. Maybe this euphoric feeling and elevating feeling of the ability to step outside the box and look at life's patterns from a high perspective is the inspiration behind the slang term of high itself, says philosopher Sebastian Maricolo.